Hello, everyone. My name is Rafael Pacheco. I am an Associate Dean for Digital Technologies at the Dental College of Georgia at Augusta University, and also Section Director of Dental Materials at the Department of Restorative Sciences. I'm going to try to summarize this presentation about this adaptive technology for dental materials education that was given at the Northern Lights meeting in 2025, this meeting organized by Dr. Richard Price. Um, the main reason for this conversation is that we all face challenges in dental materials education. I think I share many of these concerns with specialist educators and dental materials educators in our case. It's hard to maintain engagement with students. We're all fascinated by the topics or really interested about everything that happens, the chemistry, the physics behind the scenes. But it's hard to maintain their engagement. Some students find it dry, find it boring. They have different backgrounds. So some are engineers from their majors, some have majors in history. You give a C course and you have dental hygienists in the room. You have seasoned clinicians, you have dental materials faculty, you have dental hygiene faculty, you have residents, you have recent grads, and it's very hard to find a middle ground there. Students are afraid of asking questions. It's impossible for us to give feedback to every single student in a classroom with over 100. It's hard for us to have an exam that are made of all open-ended questions. So we're using multiple choice questions, which is perfectly fine if we build them correctly. We can assess different levels of learning, but it's hard to do that. And many of these students, they will find the relevancy of that dental materials topic after they graduate. So here's an example from a recent grad from last year that is in a very competitive endodontics program right now, saying, really wishing I paid more attention to your dental materials course talk. I'm looking back at my notes a lot these days from your class. And this is someone in endo. Imagine someone in GPR, AGD, grad pros, or even in their general practice in their office, then they see the importance of dental materials. So with that in mind, I had this idea of having a tool using technology that could create personalized learning paths for different learners. So I reached out to a colleague at University of Florida, the College of Dentistry, Dr. Mateus Rocha, who's very knowledgeable with artificial intelligence and programming. I have programming background as well. So we came up with this adaptive learning tool that we just applied for copyright at the end of last year, and were granted this year in July. And what this algorithm does, we called it the adaptive learning algorithm. It checks for many assessment points in a specific timeline, and depending on how correct the student is and how confident they are, they go in specific paths. Also, depending on how much time they have taken for that specific path and their performance history, those are deciding factors for them moving on or not on that too. So basically, if they're correct and confident, they move on. If they're correct but not too sure, they have reinforcement questions. If they're incorrect, they have remedial branchings. And if their time is running low, the algorithm prioritizes the essential content. Here's an example of that decision tree. The students start here and are presented with a case. They're asked questions in varied formats. If they get it incorrectly, they have remediation videos, 30-second videos, alternative questions where they're checked again that they can go back into that main decision tree, or they're going to go into remedial branches again if they make mistakes. And they can be all going into different paths depending on how confident they are or how correct they are. And we have 18 topics with 7 3-minute videos along them, and we separated them into tiers because in every specialty education there's a lot of things that are nice to know with this lime green here, or things that are good to know. There's a lot of things out there, many publications talking about all of the little details behind the scenes of everything. But for a general practitioner, there are things that they must know about that topic. So they must know a lot of things from a lot of specialties. So we need to focus on that. And the goal is to flip this pyramid in a way that the base of it is must to know things, and then good to knows and nice to know. So we have this tiered content with 10 topics for the must know phase, capped at 45 minutes, 5 topics at the good to know phase, capped at 75 minutes, so 30 minutes for that. And then the nice to know phase will have 3 topics with a maximum time of 90 minutes. And by doing that, we make sure that the students that have to learn the must know, that haven't mastered the must know yet, that they stay into that phase. And the ones that already know about the topic, they can move on to learn things that are good and nice to know. So we have 54 total assessment points across the different pathways, and we vary the type of these assessment formats. So there's multiple choice, multiple answer, combination of many of those open-ended questions with immediate feedback from AI, so we can rate what the students are talking, and they talk to actually like patients, assistants, faculty, just like they're talking to another human being. And if they're correct and confident, they move on. We also have over 35 remediation videos. So if they make a mistake, they watch a video immediately and are assessed again. So the students that got it correct, they don't have to do that. They can move on that decision tree. We have 7 core 3-minute videos, so everyone watches those if they move on. So everyone watches the 4 videos in must know. The ones that moved into good to know, everyone will see the 2 videos in good to know. And the ones that moved into nice to know, everyone will see 1 video in there. There are over 100,000 different possible pathways. If we go into the actual calculation is 68 billion, over 68 billion, but because we have time constraints, we limit to about 100,000. And we also created engaging characters. So all of these dental materials topics are presented in a clinical relevant way. So he created these funny characters like Phil McCavity, James Carey's, Archie Bridges, that all are related to a specific knowledge field. Like Phil McCavity is in operative dentistry. We talk a lot about amalgams, composites, bonding, light curing, and so on. Here's an example of a question that the patient presents and the student will answer, submit after they select their confidence level that goes from 0 to 100, and they get immediate response from the AI like the patient was answering them. So we can also make those patients have some emotions to respond differently. We have combinations of multiple choice with multiple answer, ranking with multiple choice, with spinning. So we make all these different combinations of assessment. Here are a few examples of a student that is pretty confident and knows about the topic, which is great. Someone that knows what they know and what they don't know, so pretty average here. And then here's an example of someone that is really confident and do not know about the topic too much, so they need to recognize those gaps. Or someone that really knows about the topic, but it's not confident at all. So they also need to build confidence. And someone that doesn't know about the topic and is not confident, we need to sit down with that student, have a one-on-one meeting to see where the problem is. Here's that tool being used in the classroom. You can see like the students are not being distracted by any digital equipment, cell phones, nothing like that. Everyone is focused. Everyone is watching their own videos or talking to their own patients. So everything is personalized here. Here's a different view of that. Someone is watching a remedial video here, someone's talking to the patient here, and someone is getting feedback from Dr. Rugberg, who's actually sitting across from them there. And of course, I used AI for that as well. We got very positive feedback. Here's an example. It takes me a bit longer to understand things. I like that I had a chance to process the information before I moved on to the next topic. My classmate beside me was ahead of me, but it didn't bother me. I would rather this than a lecture because when the professor moves on and no one else has questions, I don't want to be the only one with a question, so I don't ask. This was so easy to understand. So this is very positive. We had an average rating of 4.5, 4.4 out of 5, 88 satisfaction rate. So 56% was excellent, 32% very good. And we asked all of that through SWOT forms, so evaluation forms that had strengths, weaknesses, opportunities, and threats. And this is a summary of the main topics that were mentioned with those forms. And in summary, I presented with these challenges in dental education. So to maintain engagement, we create interactive cases. For diverse knowledge levels, we created a tier content with adaptive timing. The fear of asking questions, students have private AI interaction, so no problem with that. Scalable feedback, whoever makes a mistake watches a remediation video. Visual learning needs, there's a lot of videos embedded there and animations. Clinical relevance gap, we created clinically relevant patients. And for the beyond multiple choice, we have diverse question formats, even with open-ended formats with immediate feedback. So overall, thank you very much. Muito obrigado. If you have any questions about the tool or if you want to collaborate, this is my email address. It will be a pleasure to talk to you. Thank you.